Hi everyone, my name is Dr. Sarah Westen. I am a clinical assistant professor and licensed psychologist at the University of Florida. And I'm also director of diabetes, behavioral medicine, and psychology at UF Health. I live with type 1 diabetes myself for going on 19 years now. And given that, I wanted to talk today about a few tips for staying emotionally well and coping during COVID. And one of the things I wanted to talk about was the importance of maintaining structure and routine in your day-to-day life and how sleep might fit into that picture. So first I want to say it is so easy for us to get off of our routines and to get off of our structure in day-to-day life in a time of crisis like this. And that's okay. That's okay. When we're not going to school or we're not working or we're not, going to an office or a place where we typically would go throughout the day, it's easy for our brains to get confused and for our motivation levels to drop. That's normal and that's okay. But it just means that we need to develop some additional routine and structure in our lives in order to maintain our mood and productivity. And in doing so, we're going to in turn help our own diabetes management. So my tip, it's very, very important to try to set a schedule for yourself. Waking up at the same time every day and going to sleep at the same time every night, or about the same time, can really help your body adjust to a new routine and get yourself into a rhythm of behavior. So if you wake up in the morning, and try not to sleep in too late if you don't have to be somewhere, take a shower, get dressed, do a small activity that gets your body moving, either in the home or outside your home. And try to stay active and do what you would typically do if you were about to go to school or to go to work. Getting dressed, actually sitting at a table or a desk where you can do your work and kind of make a station for yourself can really help with focus and staying goal-oriented. You can also set a schedule where you say, hey, I want to accomplish this goal maybe by 10 a.m. or by 11 a.m. or by 3 p.m. I want to be in this place with learning this topic or doing this activity. Maybe you might want to say, I want to get X number of steps in today, whether you go for a walk outside your home or kind of stand in place in your house and do some push-ups or some other exercise activities. It's really, really important to maintain that level of energy and structure and focus. Now, sleep is important, especially for diabetes management. And right now I'm principal investigator on a study looking at how sleep impacts glycemic control and also mood and psychological factors in our lives that may impact our ability to engage in our diabetes management. What we're finding is that there's a set number of sleep hours per night that if you get too little sleep or too much sleep, it can impair your mood and your motivation the next day. And it can also change how much time you're spending in your target blood glucose range. So we know if you sleep too little, you can get a little bit more irritable and you can lose motivation to engage in your diabetes management. But there's also some evidence to show that that might actually change your insulin resistance and change how your blood glucose levels are the next day. So maintaining adequate sleep is super, super important. And that set schedule of a time of when you're going to wake up and go to bed can help you with that. It can also innately help you set reminders and strategies in your life to say, hey, I need to check my blood glucose now, or you're eating at similar times throughout the day because you have a set schedule, which is going to help you maintain that stability as well. So schedules, routines, productivity, but be patient with yourself. If you're not as productive as you typically would be, that's okay. This is a time of high anxiety and more distress than we typically experience. And it's okay to feel that. But remembering to use your coping strategies, stay in touch with loved ones, exercise, get sufficient sleep, eat well. These are all things that can help you maintain that sense of stability and maintain your quality of life. Take care.